Okay.
Okay, I'd like to welcome Louise Rath, who's a nurse at the MS Centre at the Alfred Hospital in Melbourne, and Dr. Anneke van der Walt back again for our COVID session number 5. Not very pleasant circumstances to be bringing you both together, because we know that COVID is a really high transmission in the community and a lot of people with MS are suffering at the moment. So we just felt that it was timely to get some information out for people with MS, and we're certainly having a lot of calls coming into MS Connect about people who have COVID or who are worried about that. So, Louise, tell me a bit about what it's like at the MS clinic at the Alfred at the moment.
So I think at our infusion centre, we're actually testing people with rapid testing, and we're finding that there is a small percentage of people who are asymptomatic who are positive. So we're dealing with that at the moment. And we're also getting lots of patients ringing in who have tested positive on a Rath test at home or a PCR and wondering, what do they do now? So they've been the main questions that have been coming in.
What do we do? And Anneke, is there any treatment for people who have MS for COVID?
Yes, Jodi. So I think this is really important that we raise awareness for this, because there certainly are treatments available that people with MS can access. And this would be particularly important for any person with MS that's on ocrelizumab, who's on fingolimod, or anyone who has a lot of other medical problems. So people with, say, who have a really high body weight, people who have high blood pressure or heart problems or lung problems. You know, people in that category really need to let us know and let their health service know that they have COVID, because there is a treatment that is available that also seems to still work for the Omicron variant that people can access. The thing with this is that you have to access this within 5 days of testing positive or developing symptoms. So, and that's why it's quite time critical that we know about people in that category, because the earlier we know and the earlier you get tested, the earlier you can actually access this treatment. The way that you access this treatment is actually through a healthcare provider that have to report your case and then organize this infusion as close as possible to your home address for you. So it is a bit of an organization to get access to it, but it is very effective, and it does seem to work really well for people with MS, the same as it would for anyone else as well.
I think that's really important information that we do give to people, because there are a lot of people who don't know about, is that right, antivirals, or do we call them antiviral treatments?
Yeah, look, this medication is called Sotrovimab. There's a number of antivirals that are tablets as well, but they may not be as effective for the Omicron variant. So the Cetravomab infusion is the one that we recommend. So it's basically, you know, for some people that's familiar with ocrelizumab and natalizumab, it's a similar thing where it's very targeted antibodies that's put together and they're given as an infusion that runs in quite quickly. And what this infusion does is it just provides the body with extra immunity to fight the COVID-19 Omicron virus, or any of the COVID-19 variants actually. So it just gives you a chance to minimize the symptoms and get better quicker. So it's you know, it's really definitely recommended for anybody at risk of a severe infection. And in the people that we look after, this would be people on ocrelizumab and people with other comorbidities, other health problems, like I mentioned, or anyone who hasn't been vaccinated properly.
And I know that treatment is also available in, it's not just, I know you guys are based in Victoria, but New South Wales, ACT and Tassie are also really encouraging people with MS to get in touch with the people who can help them access this certain treatment, and later on in the discussion we can talk about how they can do that as well too. Certainly, Louise, and how's it been going? Is it a hospital stay, or is it just in?
No. So what's been really interesting is when the patients have rung in, they've thought because they had mild symptoms that they wouldn't qualify for this drug, and that they were adding a burden to us. But what we're saying, even with mild symptoms, this is the type of patients that we want. We really want to stop hospital admission. So don't feel bad if you think you've only got mild symptoms on day one. This is still a really important treatment to reduce severity for you. The patients that we've referred, and we've referred lots now to the 3 or 4 sites around Melbourne, we've done New South Wales. It's been a very simple process. The patients have been contacted within 24 hours, and they've all been really very happy with the 30-minute infusion, 30-minute observation time on the way out. And it's a very slick process in an infusion centre that you come in by yourself and then you can leave. A couple of sites have got a bus that pick up people who are positive, who can't actually, use taxis anymore. So that's available as well in some sites. So it is a very easy process, and you're not burdening us by saying you've got mild symptoms. So please let us know.
And anyone else who doesn't have the luxury of an MS clinic that's easy to access, MS Connect can also help you access it. And some of the programs that are available through different states are also really encouraging people to access this as well too. I know that in Canberra they have a bus where you actually go and have a big bus where you go and have the infusion as well too. So it is available in all states, and I think the message really important is that early intervention, even if you're mild, is where you're going to get the really good outcomes. So so access for that. And we've also Anneke, we've also been getting a lot of calls from people with who are really worried about their worsening symptoms during COVID, their worsening MS symptoms, worried that they're having a relapse and what they should do. So what would be your advice if people, ring in with that or are feeling really worried that their MS is getting worse?
Well, yeah, Jodi, I think that's a really important issue because we know that anybody with MS who gets an infection, who becomes unwell, can have a reactivation or sort of a restart of all of their symptoms. So it certainly can feel like a relapse. And what we would advise is that people keep a close eye on this. So as you feel better, whether it's from COVID or from another infection, your MS symptoms should gradually improve as well. So it wouldn't be unusual for vision to be blurry, for your head to be foggy and feel very tired. Pins and needles could get worse, walking could get worse, all of those things could get worse. But as you feel better from your infection, you should generally feel better from an MS perspective as well. If you're in a situation, however, where your symptoms are really severe, so you can't safely walk, you can't see, you are at risk to yourself, then you really should present to an emergency department or at the very least contact your MS doctor, your MS nurse, or MS Connect to let people know what's happening, because it could very well be that you might need support to ride out these symptoms and make sure that you're safe during it. It would be very, very, very unusual for people to have a true relapse because of a COVID infection, but it is not impossible. And especially if the neurological symptoms linger or get worse, even after your COVID symptoms improve, you really need to get that looked at. So the first point of contact would, of course, be your, nurse on call, doctor on call, your primary care doctor, but also your local MS service, if you can get through to them as well.
Because it's very worrying for people because it's can be quite severe, so it really can knock people about as well. In terms of managing the symptoms for COVID, is it okay for people to do the same things as what they recommend? Can people with MS still have the Panadol and the Neurophone, or do we need to do something different?
No, it's exactly the same. So you can still take all the treatment you would take for a cold and a cough. So take Panadol, take Neurophone if you can, keep yourself well hydrated, and try and, eat well, rest as much as you can. And of course, let people close to you know that you're unwell so that they can check in on you, and support you along the way. But it's really the same management. When people should get worried if they continue to deteriorate, if they're having any breathing problems or really high fevers that are not settling within a day or two. Those are things that really should be reported to your local doctor, or if it's bad enough, into an emergency department.
Yeah. And Louise, what about, have you got any other tips that you're giving people?
So a lot of patients have been ringing in saying, look, I know I'm going to get COVID, I'm young, I've got a partner, I live in a shared house. So they really want to be prepared. And so we've just been recommending, make sure you have some Panadol, make sure you have Neurophone if you can, cold and flu tablets, because people can get quite congested in the head. A bottle of Hydrolyte if they're feeling like they're getting a little bit dehydrated. Icy poles in the freezer for a, sore throat, maybe some meals. And just a little plan if you have a dog, who's going to walk the dog if you're stuck for 7 days. And people have felt really reassured if they just have a few little things set up so that they're right to go.
I think as it gets harder and harder to access things, often it's the whole families who are affected as well too. So you don't have that other person who can duck out to the supermarket with you. So there's lots of DoorDash and Uber Eats and things like that, which it's worthwhile knowing in your local area what services can deliver things that you might need if you've forgotten the toilet paper or the dog food. They're just and you're feeling unwell, so that you may or may not feel unwell. What about the case when somebody else has got COVID in your home? What would you recommend for that, Louise?
So what we've been recommending is, if you can isolate the person in the room furthest away from the general areas or shared kitchen and lounge room, that the person, if you can have the front door and the back door open most of the time to let air flow through. People are recommending not turning on your air conditioner because it comes through each room. The person who is positive, to have their bedroom window open so that the air is flowing, and there's lots of good ventilation in your house. Hopefully, if you can't do a toilet, separate toilets and bathrooms, to just wipe it down as much as you can. Some people in shared areas, if they can't, are wearing their mask inside just to give them a little bit more protection. And some people are actually using the sausage or the towel to just stop the airflow of the positive person's bedroom coming out into the central areas. Just all simple things of ventilation and trying to separate as much as you can.
I think that whole thing about the mask is really important, Jodi. So for people to know that an N95 mask is much safer than just a normal cloth mask or a surgical mask. And if people are worried, that they should be wearing those as much as they can.
That certainly makes a huge difference what type of mask you have, and it might be something that people think about when they're isolating with someone else who's got COVID in their house. What about the big question that we've certainly had this week is accessing tests. So have you got any tips? I'm hopeful in the country that next week the situation won't be so bad. But what are you recommending for people who are sick and unwell with MS about going to access tests?
Hopefully, for the majority of people that we've talked to this week, they've had rapid tests in their house. So I think on one level that they've got to remember to upload the rapid test, and that they don't need to go out and get a PCR after a positive rapid, that is enough for you to get sorted. If you don't have a rapid test at the moment, Anneke, would you just recommend trying to get a PCR?
I think, it is worth trying to get a PCR. And the reason for that is that you will need some sort of positive test if you want to access the treatment that we can give you for COVID. So if you don't have access to a rapid antigen test, and I know I don't have any, I've tried many times, but if you don't have access, try and get that PCR test. And if you're not getting your results, because we know we've had patients that had their whole sample thrown out, I guess I have to assume that you are positive and isolate for that 7 days and let your close contacts and social contacts know that's what's happening. And also let us know so that we can still treat you and see if we can facilitate any help. especially if you're feeling unwell or you're in that high risk category of potentially getting a more severe infection. But where possible, it does make things a little bit easier if you can access a test. But it's not, like we all know, it's been really, really difficult.
Yeah.
It has been really difficult. I know now they're doing they do two lines in a lot of the testing centres. So there's a line to go and get some rat tests, and so I think every day things are improving. I know it's been an incredibly challenging week for people trying to access that test. And like you said, early treatment and early intervention is really important. So please, we really would encourage people to give their local clinics a call, MS clinics, or give us a call just to see if we've got any way that we can help. We don't have any magic tests either, but we often have tips and suggestions for the way that people might be able to access those tests as well too. So what about people's regular MS treatments, Annika? Should we stop? Should people stop them? Should they delay them? Should people, on their, for instance, on tablet like Gilenya, should people stop that because they've got COVID?
Yeah, thanks, Jodi. Look, I think it's really important that people don't stop their treatment. So it's really can be quite dangerous if you stop treatments like fingolimod or Gilenya, Mayzent or Siponimod, or any of your other treatments. So it's really important to, just keep going with those treatments unless you've been given any specific advice. With the infusions that that people receive, we're advocating for people to continue as much as normal as possible. But because of the crisis that the healthcare system is in, we are anticipating that it could be that it could be already tricky to get your infusions in some parts of Australia, and that it could get trickier over the next few weeks, just for the simple reason that nurses and healthcare workers are going to test positive, or they could get redeployed to other areas. Now, this is generally not a crisis. If we have to reschedule or we push things a little bit, we can do that safely for most people, and that your healthcare service, who generally, organizes that infusion for you, should be able to advise you what to do if your infusion gets cancelled. But other than that, there really is no reason not to go unless you are positive, or you think you have symptoms, in which case we could reschedule it. But yeah, otherwise we just keep going for now. Similar to the other waves that we've had, we just don't know when this will end really. We don't know that, the epidemiologists don't always get this right. So it's better to just keep going unless you have any specific advice to delay.
Yeah.
But I guess in saying that, if you have any specific concerns about your own health, is to discuss it with your healthcare provider to see if they suggest anything else.
Yeah, sure. But and what I'm hearing is that stopping your medication, especially if they're daily tablets, won't help you recover from COVID any quicker.
It won't. And that's the thing, is same with all of these treatments, it's not like your immune system just bounces back immediately. These drugs have long-lasting effects. So the only thing that you could actually harm or make worse is your MS. So it's not necessarily going to change the way that COVID affects you.
Yeah. And what about if people have had access to Sotrovimab or a treatment for COVID? Can they still continue their MS treatments with that?
They can. Usually we would, because the Cetravomab is in your body and it's an antibody, we probably wouldn't give you something that could remove that antibody for at least 2 weeks after, just to make sure that, you get the best benefit of that treatment. But otherwise, we just continue as usual. If you're on a tablet or, anything, anything for MS, generally you just keep going.
Good to know. And what about vaccinations? What about people who've had vaccinations? Can they still have their booster shot or third dose with COVID or during this time now?
Yeah, look, I think generally they are recommending that if you've just had COVID, that you can delay your next vaccination for a few weeks. But if you haven't had COVID, then, you just go ahead and have your third dose vaccination. So the third dose is generally required for people on ocrelizumab, fingolimod, or ocrelizumab, and also Mayzent or Siponimod. And people can have that within like 2 months after their last shot. So that's really important. And then people still need to get their booster. So everyone else needs their third shot. And people on ocrelizumab or Ocrevus, Mayzent or Gilenya need a fourth shot, a fourth dose, and that can be accessed 4 months from the last one. So it's really the best way to protect ourselves from a severe infection. So it's really important that people book that in and that they make sure that their family members are also vaccinated.
I've had lots of questions, Jodi, about is the booster a reduced dose compared to the primary dose? And, you know, it is a play on words, that it is just the number of vaccines required, and it is the same dose and strength, whether it's Pfizer or Moderna or whatever you're having. It's not less or more being a primary or a booster.
And so the people who've had the third dose still need the booster. It's just the timing of it can be 4 months after that. So the timing is sort of catching people up. And what about if they've had the antiviral treatments for COVID? What if they've had a treatment for COVID? Can they still have a booster then?
They can have a booster, but again, I think they advise usually you can have it a little bit later. Because, you know, you do have that increased immunity from actually getting the infection and from having the treatment. So you can still get your vaccination. I'm not, to be honest, I'm not 100% sure of the timeline, but it's between 2 and 4 weeks. Like I think it's up to 4 weeks later. You can.
I thought it was 4 weeks after.
4 weeks, yeah.
And I guess what's happening is that information is changing a lot, you know, and certainly at the moment information is changing every day. And I know that the team here, I know your team is working overtime to keep up to date with that information, and I certainly know that our MS connectors are also working really hard to keep up to date with all the information that's changing in each of the different states, in Tassie, ACT and New South Wales. And each of these states and territories have a specialised program to support people with extra care. And most of those programs are accessed via when people get a text to say they're positive. But certainly there are other ways that people can access specialised programs through, with each government is offering people extra support that's normally run by doctors and nurses. And no program particularly at the moment is perfect because there's so many staff that are stretched, and but certainly they are there, and they can also be a way that people can access getting the treatment for COVID with MS as well too. We've had some success steering people through that pathway. And what about in Victoria, Louise? Is it similar in Victoria?
Yeah, so if you get a positive text from the government, you will normally get a COVID pathway, and you'll get a text or a phone call depending on where you live and the response to the survey. So it appears to be still working pretty well. Recently, it was yesterday that a patient had received a text, a follow-up phone call, and then the survey of wellness and how they're travelling. So, but if you don't get any texts, you know, still call your service or MS Connect. It's not a perfect system, but it still seems to be working well.
Certainly, yeah, and I think the messages as well have been in other states that that these programs exist, and we are certainly happy to try and help people. Some states where there's perhaps less transmission than Victoria and New South Wales have got dedicated phone lines, and New South Wales have got a dedicated phone line for to really link people in with extra care who are vulnerable, who need it, and that's the people that we're all trying to support as best we can. And so I'll wrap that up here. But thank you so much both for your time, and we really hope that things get better, that people are able to access tests, and we're thinking of you and all the healthcare providers at the front line who are doing such an amazing job looking after people with MS. So thank you so much for your time today to just give out that basic information. That information will also be available from MS Connect on 1800 042 138. So if anyone's got any concerns, need any extra help, then please reach out to us and give us a call so that we can help you try and navigate and negotiate and with your symptoms and any concerns that you have. So thank you again, all our very best, and we wish you well.
Thank you. Bye.